will be confirmed again because we will need to do either the quiz or the exam during the last week of this semester or during the exam cycle. Okay, but anyway, there is a confirm or final assessment for this subject. Okay, either it is a quiz or an exam. So any questions so far? Any question? Alright, so let's continue. Okay, so let's start with our first lecture. So in the first lessons of our ethics in healthcare science, so we will try to introduce some of the term, okay, some of the terminology or some of the common use word involved in this lecture. So the first thing, what is ethics? Okay, because the title of this subject is ethics in healthcare or science, right? So what is ethics? This is a very basic question. Anyone? Anyone has done some research before to look into what is ethics? So actually, ethics is a branch of philosophy, okay, that to examine whether certain activity is right or wrong. Okay, in a simple way, it is also can term as the moral, but in a professional way. It is a bit different from what you have learned from the high school or in your previous level, but this one will involve a lot of informations in the healthcare or science. So what is the moral and what should you do, and what is the correct actions or wrong actions involved in the medical science. So is ethics a character or feeling, or is ethics just a belief or a social norm, or is ethics a standard, or is ethics a law? So you already know it is a moral, right? So what is it? Do you think that ethics is something based on your personal belief or based on your personal value? Is that true? No. Okay, I heard some question. No, right? So if you say yes, so meaning that every one of you will have a different standard of moral. So your moral may be different with the moral of another person, right? So of course this is not a personal belief. So it will involve some standard rules, right, or standard guideline, right, to differentiate what is actually wrong and what is actually right. So, and for your information, ethics is not law. Okay, not all the ethical issue or not all the ethical activities are actually according. Okay, not all the activities that are lawful, okay, are actually ethical. It is not actually forced to comply the ethics according to the law. So we will see more example after this. So the next one, we will have some. Where do you able to get your morality come from? So after you already know this one is your some morality, okay, in a professional way. So you can actually acquire all the informations, what is right or wrong from your childhood, right, from your parents, and then from your religions as well. So doesn't matter which religions you are belonging to, doesn't matter what are the origins of your religion, but usually all the religions will tell you what is the good thing and what is the bad thing, right? So they always to educate you all to do the right thing or to do the good thing, right? So any religions will teach you to do the wrong action. No, right? So from all the different types of religion, they will ask you to do no harm, do all the good thing, act positively. Okay, agree? So and then we will have school. So during your school period, so you are actually already educated with what is wrong activity and what is the correct activity. And we also depends on the common sense sometimes. Okay, you need to use some thinking to think whether your action is correct or wrong. So another terms we will encounter in this subject is the healthcare. So it's related to all the activities that promotes your health. can increase your health regardless of anything. Okay, we can categorize the different categories of healthcare promotion, healthcare into health promotion, such as if you attend some nutritional class, aerobic class to improve your health, because you know that all those classes can increase your understanding or promote your health, right? So, and then we have the disease prevention. If you attend any vaccinations program or cancer screening program, so you know, right, why do you want to attend all that? Because you know that it will bring some beneficial to you, it will bring some benefit for you to prevent some disease. And diagnosis is all the lab tests or imaging. Okay, and then interventions, another name for interventions is the therapy. So all different kinds of drug you taken or all surgery you taking, okay, is encountered in the healthcare science as well. And then nursing, all the activities from the nurse, okay, taking care of a patient, or set up all the vein infusion system, okay, are all classified as the nursing. And rehabilitations is all activity or all situations involve the recovering after you already done maybe stroke surgery. So you need some times, right, to recover from the recover from the surgery. Or another example is the physiotherapy. Okay, after you already have some accidents, you need to recover from the normal physiology activity. So you need to do some rehabilitation to recover, do some physio activity. So all this will be involved in our subject. And the last term is the healthcare science. So what is science? So the science is actually an investigation, systematic investigation to actually search and answer for an issue, right? Or for a scientific investigation. Or usually we known as the scientific question or hypothesis. You want to find an answer for a scientific question. So the term of healthcare science is actually you want to seek, is a systemic investigation in looking for solution. You want to try some solution to solve some healthcare problem. Okay, you have some problem or you have some disease, and providing the basics for the practice. So the main focus of this subject, okay, in this ethics of bioethics in healthcare science, so it's actually will cover all the 4 principles. So please remember all these 4 principles. The first one is the respect for autonomy. Okay, so am I going too fast? Can you all follow, right? Please let me know if I'm going too fast. Okay, so the first one, the first principle is the respect for autonomy. So what is the meaning? So usually we say autonomy is the freedom to choose, okay, freedom of choice. So always patient, you need to give the patient the freedom to make their own decision. Okay, we have to respect for the patient's self-determination. Okay, we have to respect what they want to do. Okay, what is it, the respect what is their goal and what is their value, because every people will have their own thinking. Okay, so the next one is the non-efficient. So in a simple word, it is actually saying that to do no harm. Okay, do not do anything that have a risk of harming the other person. Next one, beneficial, to do everything in good, to do all good things. Okay, so the all good things is also involved to act positively. Okay, always maintain a positive attitude to contribute to the society or to the specific groups of the person. And the last one is the justice. Justice is actually saying the fairness. Okay, so the equitable distributions of doesn't matter, either benefits or it's actually a disease burden. Okay, you have to distribute equally. So there is always, just now in the subject learning outcome, we actually already touching some the terms of the bioethic dilemma. Okay, so the trolley problem, here I'm showing you one example of very popular example of the bioethics dilemma. So the trophy dilemma problems is actually exists from 1967. Okay, where you can see that actually there is a trolley train coming downwards towards the track of 5 workers. So there are 5 workers are actually working during the track of the train. However, please imagine, okay, imagine this is you, okay, so this one is you, and you are happen to be by chance standing next to the switch. Okay, so what is the function of this switch? Where you can actually flip it to direct the train, the trolley train, into the another direction. Okay, but the problem is another direction or another routes of the track also have another worker, but only one worker is present in the track. So what are you going to do? Are you going to flip the switch? Are you going to flip the switch to save the one worker, to save the 5 worker, and let the one worker die straight away? Or you will just let it be? Just let the 5 worker to die. So this is one of the example of the bioethics dilemma. So always there are no specific solution. Okay, there is no very clear distinguish of the right and wrong. But in this situation, what are you going to do? Let's say, because we are actually in an open discussion, don't worry. Okay, so what are you going to do? So let's vote. Okay, let's vote. Come. So how many of you is going to flip the switch? Flip the switch and directs towards the one worker. Please put down your hand. Okay, for those who want to flip the switch, put down your hand. Yeah, put down.
Can do one touch.
Okay, for those who want to flip the switch, raise up your hand. Okay, raise up your hand. Flip the switch. Not many of you, Not many. Really? So you all will just let the train to go straight forward towards the 5 worker, is it? Is it? Okay? Okay, no, right? So based on the survey, actually 90% of the people will agree to flip the switch because they want to save the 5 people, 5 persons of the worker by sacrificing 1. But in terms of ethics, is it right for us to sacrifice this worker? No right. Actually, it's no right. Okay, let's switch a bit the situation. So now you are standing. Imagine you are standing above the bridge. So there are no second routes or no second options, and the train is coming down straight towards the 5 workers. Okay, so you are standing on the bridge over the train, and now in these situations you have a huge man. Okay, imagine you have a huge man standing next to you. So you could only stop the train. You could only stop the train by pulling that huge man. Okay, and blocking the train towards the 5 men. So what are you going to do? So are you going to pull the man?
我看到你就讲我很怕。
全部一起死。But the man will die lah. The man will die. So what are you going to do? Are you going to pull down? So it's the same, right? You are going to sacrifice 1.
我要保我命可能我先跑。
在桥上面就跑掉了。Just pull him, right? To sacrifice him and to save the 5. So I think all of you count right the mathematics. You want to sacrifice 5 or you want to sacrifice 1 worker. But based on the analysis, in contrast to this situation, only 10% has agreed to pull down the huge man. Why? Why? It's the same. Actually, it's sacrifice 1 worker to save the fight. But why this attitude is actually not acceptable?
这有分6个意思哎。
Sorry? Involvement?
Like you're more involved in the action, like you're directly responsible for the death of
Because you know pulling a person is wrong, right? You know pulling. You are kill in terms of you are killing. So what is the problem here? Has you asked the permission? Has the huge man agreed to being sacrificed? Have he been asked or has he agreed? So before obtain the agreement, okay, before obtain the consent, okay, what known is consent. Yes. Sorry? You mean she wants to jump, so you want to sacrifice yourself?
有人问为什么不要跳下去？
But
你要跳吗？
is we are
跳哎！
still sacrificing, right? We are still sacrificing.
但是你跳你就死。
Okay?
不要动了。
So we are not actually arguing, we have actually a lot of information. Yeah, some students used to told me, Miss, why don't we just shout and ask all these workers to leave the track? Right? Yeah, but in this situation, what we want to discuss is the bioethics dilemma, where when you have facing, this one just an example. We are not going to argue what is the exact solution or exact answer for this, but we want to know when you are facing a more complicated situation like this. So what is your decision? What are you going to do? Okay, of course you experience a lot of different cases, okay, which will be more complicated than this one. So this one just show one of the examples.
Fireman.
Okay, so from the theory problem, okay, from the theory problem, actually what we can obtain, what are the informations or what are the moral reasoning we can obtain from the problem is actually divided into two categories. One is the categorical morality. So what is categorical morality? So meaning that something right is right, wrong is wrong. Okay, no matter you are going to save 5 people or you are going to save 10 people, killing is not the right thing. Okay, right is right, wrong is wrong. So they differentiate very well based on their action, regardless of the result, regardless of the consequences. Okay, so for another example is the stealing. All of you already know, right? Stealing is not good. But what if a person say, I perform the stealing action is because I want to save, I want to help all those starvation children. This is not an excuse, right? We already know stealing is wrong. So regardless of what are the results or what are the reasoning you are doing for this action, it is considered wrong. So the next one is the consequentialist. So for the consequentialist, actually it is a theory that actually will consider the outcome. Okay, just like the theory problem. So why 90% of the people will agree with the action one? Okay, to flip the switch. Because they agree that it can create greatest good for the greatest number. They feel that it's okay to sacrifice 1 worker to save 5 workers. And all of you agree as well, right? Just now, some of you also raised your hand, right? It's not wrong, but based on the theory of these consequentialists, it is actually at that moment that is your best choice. Agree? Okay, right? Can you all follow? So it's actually you consider what is the consequences, what are the outcomes will happen. So always they will go towards the greatest benefit, greater happiness, and the greatest number of workers. So I already finished the brief intro of the ethics. So next one we will go through the history. Okay, I will go into some of the history of the ethics and the evolution. How is actually this ethics or this standard evolved from the previous generation. And don't worry, you do not need to memorize all those years or all those history. Okay, this one is just to create the awareness for you to aware how is the development or evolution, and we will do a more clear dissecting of the ethics principle. Okay, which are the 4 principles we cover Just now, we will go into more example and more explanation. Do you all need a break? No, right? Yes, yes. So for those who need a break, maybe just a very quick break, 5 minutes. Okay. Okay. Before we go to the next part. This lesson, so you need to make sure that you know the evolution. No need to, you do not need to able to describe, but you need to know the impact of the historical event on the formations, the current ethics in the healthcare and its evolution. So how it is undergo the evolution. Always we will improve, right? The ethics standard will be keep improving to become a better, to provide a better coverage, to provide a better protection. So the next one we have the we discuss some ethical theories and the principle in the healthcare service. So just now we already gone through what is ethics, right? It's actually a branch of philosophy that examines whether your activity is correct or wrong. So it is actually based on the conscience. So what is conscience actually? So the conscience is actually a person's sense for right and wrong. So you have your sense, right? Common sense or sense to differentiate what is the wrong and what is the right thing. But why, if we already have equipped with this sense, we still need the ethics? Why we still need a set of regulations to regulate our behavior? Why? Because you already know what is wrong and what is right. So why we need to do all these of regulations?
Principles guiding our conscience.
Yeah, and the exact answer is actually every people, they will have two views. One is desire. You want to get something, right, in a very determined attitude. But another view is the reasoning, right? You do something based on a certain reason. But what if the people already have more desire to do something, regardless of the reasoning or regardless of the common sense? There are still a lot of unethical problems happening around, right? So like, imagine if like, let's say you know like breaking a promise, okay, is not a right attitude, it's an unethical. But why there are still some people are going to break the promise? And if you imagine, the whole society is actually culturing this practice to break the promise as a social norm. So what will happen? What is the value of the promise then? Right? There are already no value, right? So the reasons we need a standard of a moral conduct is because some people, even though they know that actions is wrong, but they still desire to perform something which is unethical just because they want to achieve what they want. Okay, they are already moved forwards to the desire field compared to the reasoning. We have two different directions: reasoning, a desire, and a reasoning. And all non-human Non-human animal will actually act based on the desire. What they want to do, they will do. Okay? But people, we human, we will have some reasoning for why we want to do that. And we will have some common sense or sense of the right and wrong to differentiate. Okay? So in additional to the normal, just rely on the conscience. So we need a set of the regulations to differentiate between what are the situations that are acceptable and what are the situations which are not acceptable. And who are the people to going to regulate this standard? Who? So since we already we're going to establish a standard, so who are the people? We're going to check or regulate whether you are actually compliant or whether you are actually follow the guide of the standard. Who? So actually we will have a committee. Okay, the committee is known as the Research Ethics Committee, and we will look into more detail who are the members. Okay, who are the members qualified to be the Research Ethics Committee, okay, to regulate, to take care or to revise, to improve the standards of the moral conduct. Okay. So there we have 4 different ethical theory to be covered in this subject. So we already have came across with the first one, categorical and the consequentialist morality. Okay, by using the example of the theory problem. Remember the theory problem just a few minutes ago. So categorical morality meaning whatever, regardless of what are the results or what are the consequences, right is right, wrong is wrong. So for those actions is wrong, so it's actually wrong. Doesn't matter what are the outcome. Okay, it's classified. And then we have the consequentialist, is actually we will consider what is the outcome. So let's say you have, lying is not a good attitude, but what if you make a lie, you can save a people's life? Okay, so in that case, you consider maybe acceptable, right? In your sense, maybe it's acceptable, even though my friend is lying to me, but it's actually it is safe. Okay, it saved me from some trouble and reduce some of the harm. Okay, or eliminate some of the harm to a certain people. So for the next one, libertarian mortality. So what is the libertarian mortality about? So it's actually involve the individual freedom. So everyone, you will have your individual freedom, right? So you have your freedom to live and then freedoms to not wearing masks in the class, right? So or you have a freedoms to smoke in the environment, right? So even though you know smoking is not right, but you have the right. You can choose, you have the right. So one example is the death penalty. Okay, so even though for those criminal person, they are putting into the jail. Okay, so they have actually have the right to live, right? So is the death penalty or the capital punishment is an ethical punishment? All of you know, right? Death penalty. So some of the country has already excluded the death penalty or the capital punishment because they feel that it is a non-unethical punishment. Even though they have did something wrong and they have do some very serious criminal, but they still have the right to live. Every humans, they have the right to live. That's why some of the country, they already do some regulations in terms of the ethics to change the death penalty into some long life imprisonment, okay, or some whipping to replace of the death penalty. So the last one, we have the communitarian morality. So the communitarian morality is about like you sacrifice a person's right to contribute to the community. Okay, you sacrifice a minor benefit or minor right from a person, and you save the environment. So one example is the cessations of the smoking. Okay, so everyone you have the right to smoke, but we have a program to encourage the stop, okay, of the smoking, to save the environment, to provide benefits to the whole community, to reduce the air pollution and to save the health benefits of other community. Okay, are you all clear with the example? Okay, so next one we will go into the history. So based on the past, in the ancient ethics, in the ancient times of ethics, is actually not, they have no really standard regulation. It's just for encourage you to, people are just educate to do no harm. Okay, you can do everything as long as it will not harm to another person. It will not create any harm to the other person, right? So in a long time ago. So, and treat people, okay, treat people as you want people to treat you. So they are just covering a very basic, simple concept. Just do no harm and treat people good, and how you want to treat people treat you, then you just treat them good. However, in 1930, so we have entered a situation which we known as the paternalism. Paternalism is actually a situation or the actions that actually control the human to make their own decision. Okay, for example, because we already know that every people will have their right to decide. Patients will have their right to decide. Right, we have our own right to make decision. We have our freedom. So paternalism is actually the controversial, where people already have limited right, limited autonomy. Okay, limited autonomy to make their own decision. So for example, they have no right to refuse in medical field. So the doctor always make decision on behalf of the patient. Okay, they always think that all the physicians always think that this is the best choice, or this is the best practice, or best interest of the patient. They already decide. So this one you will do this treatment. Okay, you do this surgery. So regardless of the choice of the patient. Okay, so this is the situation in 1930, and actually in terms of the research, all the subject or all the participants is actually recruited in the research study without any consent, without asking, are you volunteer? Are you willing to join my research study? Are you okay to join with? No. They have no consent at all. So doctor can do whatever they want, and actually the patients will just, or the people or the patient will just follow what doctor say. And then after during the times of the World War II, and the situations become worse. Okay, the situation become worse where the criminal, a lot of inhumans activity, inhumans experiment, and a lot of crimes against the humanity. Okay, has happened during the war, including all the Japanese has performed all the cruel experiments towards the prisoner, and the prisoner has no right to refuse. Okay, even though they are prisoners, but actually they have limited autonomy, not saying that they have no right. Agree? So even though they are actually in the jail or actually in prisons, do you have the right to use all the prisoner in experiment, in all the cruel experiment? The cruel experiments including the freezing experiment. Just try to expose the prisoner to very cold temperature to estimate what is the time for them to death. It is inhuman, right? It's cruel, right? Or let them to suffer some poisonous gas, and to estimate and to find out what is the best therapy for the disease, for the gas. What are the best treatment? Because last time we do not have many regulations. So if you want to invention, you want to develop a drug, so you need human to do some experiment, right? So the best way you to take some prisoner and then you let them inhale and then you treat them in drug without any regulation. But all of you know this is wrong, right? Okay, and then even some prisoner is actually being exposed to harming injury. So meaning they directly by injured you using a hammer. Okay, until you are suffering to death. So all these are cruel activity or cruel experiments performed during the during the World War II. So after that, the world already start realizing we need to develop some standard Okay, we cannot let the situations become worse and worse. So actually we have developed a different standards of regulations across the time. The first one is the Nuremberg Code in 1947, followed by the declarations of the Helsinki in 1964, and then followed by a more recent one, we have the Wellman reports and the 4 principles. So the 4 principles is what I sharing with all of you, the 4 principles. Okay, the beneficial, non-malefficiency, and then the justice, and also one is what? The respect to the autonomy. Okay, the 4 principles. So the Nuremberg Code is actually the first. Okay, so based on your, we try to remember. Okay, so this one Nuremberg Code is actually emerged straight away after the World War II. Okay, after the World War II of the crime, where we already discovered that we cannot let this situation to be continued, and it is actually drafted in 1947, and it is the first international ethics, okay, internationally recognized ethics standard for research and the human subject. So after the establishment or after the starting of this Nuremberg Code, so all the doctor, okay, all the 23 Nazi doctor that actually perform crime, to perform all the cruel experiment using the prisoner are actually penalty, okay, actually being charged due to their conductions of the cruel experiment on the human being. So this one is the starting of the regulations of the ethics. So the next one we will have, okay, so in the Nuremberg Code, so actually it's already covered a lot of regulations. So it already realized that the voluntary consent is required, so no more forcing. So you need to do something, you need to recruit some participants or some human subject into your research. Voluntary is very important, whether the person is volunteer to do. No forcing or no threatening. Okay? So and the next one, the result must benefit the social, not just to perform all the cruel experiments or not cruel activity based on the own desire. Okay, you have to provide, make sure that you can justify, you can benefit what you are going to do, and no experiment directly to the human. You have to have sufficient experiment or adequate experiment on the animal study before you want to subject any disease, you want to inject any disease or any drugs to the human. No. So you need to provide sufficient knowledge or study on animal work, okay, before you treat to the human, and avoid unnecessary physical harm, no harm, and no experiment if there is a chance of death or disability. So this day, we have a very tight regulations. So if your test or any experiments is creating death or harm, so it is strictly prohibited. Okay, you will not able to get the approval. So you need to make sure you have a strong justifications why you need to do like that. Okay, and then you can always balance the risk and the benefit. Just like our vaccine, we know that our vaccine will have some adverse effect, right? We will have some adverse effects, we know, but the risk over the benefit is actually more towards the benefit. Okay, you have to make sure that whatever you do is able to reduce to the lowest risk, lowest harm and lower risk. And you have to conduct, okay, the subject can withdraw anytime. Okay, if you already change your mind and you want to quit from a study or research, you have the right to do that. Okay, don't be scared. You want to quit, then you provide a reason why do you not continue, not forcing the patients to continue or forcing the subject to continue. And the scientist will be ready to terminate the experiments when injury, if there is any injury or disability already happened. So the committee has the right to force the termination of your study. Okay, you have to report of any injury, any adverse effect, or the disability, or even death. Okay, so actually you can realize that some rules, okay, some regulations already started to set up, okay, from the Nuremberg Code, and it's just going to improve to better. So the next one, we have the declarations of the Helsinki. So this one is actually an improvement followed by the number code. And this one is established by the World Health Association member and to provide better protection to the children, okay, and mentally disabled population. So this one they will provide a more comprehensive guideline for conducting human study. So before you do all the human study, you need to test with animal first, right? You need to test with animal first, and then after, if you have really need to proceed to the human study, you need to make sure follow a tighter guideline to make sure that you are conducting provide, okay, not create a very detrimental harm or injury to the human patient. So next one, but after the establishments of all these kind of the ethics regulation, so the abuse in the medical research still continue, because in the last time that the problems will not be solved in so easy. Although we have a set of regulations, but as I mentioned, the people will still do whatever they want to do, right? So we have two different cases of example where actually researchers in a certain hospital try to use the cancer tissue from the patients without any consent from the patient. So do you think this one is an ethical or it is an example of an unethical issue? They just use the cancer tissue, right? So the patients remove out the cancer tissue, so the doctor, without asking the permissions of the patient, so they use the cancer tissue to grow the cell line, or they do a further diagnosis, or they do the further analysis using the cancer tissue. So this one is wrong, huh? So even though the tissue is an unwanted tissue, okay, but it's from the patient, it belongs to the patient, right? So although the blood from the patients is about to throw, after the analysis, we're going to throw the blood, right? The excessive blood, we want to throw away. But can you simply use all those blood? No, right? So even though it is going to be discarded, so you still need a formal consent from the patient if you want to use their blood or if you want to use their tissue. So similarly, in later time, so the children with the intellectual disability, okay, so all those children with this disability has actually infected with the hepatitis virus without any consent or without, they have intellectual disability, so we are not able to obtain their consents, right? So they just straight away, so they want to do an experiment, so they just find a group of the children with intellectual disability and straight away inject the virus into the children. So this is also one of the serious unethical action, okay, from the previous history. So next one, another example is the very serious problem. We have the Turkish syphilis experiment, so which is happening in the US, where actually this study recruit the participants and inject them with the certain syphilis virus. So syphilis virus is causing a disease caused by a certain bacteria, okay, and the bacteria can be sexually transmitted to your partner, okay. So without any sufficient information, the researcher already recruit all the participants, okay, into the study, into their research project, and the worst thing is they stop the project, okay, after injecting the patient or subject with the virus, they stop it because their reason is no funding, lack of funding. So even though you see the period since 1974, we already have some treatment, we have some drug known as the penicillin available in 1947, so the doctor just don't care and just let all the subject or participants to left untreated. No treatment will be provided to the patient at that time. So this one is a very unethical and a cruel activity, okay, was reported in the media in 1973, and this has actually created a large impact where the society already lost trust and lost confidence, okay, to the public, especially to the minority of the community, to the medical practitioners. So how we can trust the doctor if the doctor simply can get the recruit and tell you this is good for you, and then this is the treatment for what, and provide all the inaccurate information, all the misleading information. Okay, so how can you trust the medical practitioners and medical researchers? So the problem of this study experiment is involve a lot of involuntary participants. So they just say that this is nothing harm, we have the treatment for you and you just join our research study without telling the correct information, sufficient information, and without telling all the right information. Then they even provide all the misleading information. Okay, so one example of the misleading information is the spinal tap. Okay, the spinal tap is a procedure that actually extract some spinal fluid from your spinal cord, right? But some doctor misclaim that this is one treatment. Oh, this treatment is good because we injecting something into your spine. But actually, this is just a procedure to obtain. Okay, just a procedure to obtain some sample for further analysis. Wrong class. So so the correct information or the accurate information is very important. All the patients, all of you have the right to know, right, the accurate information. And this study has actually created a lot of death because all the patients all the subjects are left untreated, as I mentioned. So it's created like more than half populations or half of the participants into death, and results from the no given of treatment. And the participants has no right, no right to withdraw. And even some of them didn't know that the disease is actually could be transmitted through the sexual contact. So most of it already transmitted the virus or bacteria to their partner, to their wife and to their children. So all this is because of misleading or insufficiency of the information. So next one we have this is what I mentioned just now. We will need a committee, research ethics community, which we also know as the IRB. Okay, please remember the name. IRB stands for International Research Institutional Review Board. So, and this, who can be the member? Any one of you interested to be the member in this research ethics community? Okay, so the member, so since it's involved of the right of the patients or the right of the people, so we do not include only from the professional healthcare. Okay, we need some members with some specific expertise. Okay, professional healthcare, of course we need, but we also need some member from other professionals. Okay, some normal citizens, some volunteer from different background. Okay, we cannot just recruit all scientists because some of the patient we do not have any sufficient background. Okay, do not understand a lot regarding the science. So we need to, this is a community to associate together all different kinds of members from different background. So a non-scientist or member that is not otherwise affiliated with the responsible institute. So we do not need anyone, we do need someone with a non-scientist background. Okay, and when you when you deal with this IRB or the community, so you are strictly not encouraged to use all the scientific jargons. Okay, try to describe your work, try to describe your design, try to describe your experiment design using a very simple term and simple explanation, so that everyone from different background, non-scientists, non-professional can understand. So the role of this committee, the board, is actually approve of the research proposal. So if you are, for those who are actually interested to continue any research study, in the later time, you will need to obtain the approval from this committee regarding your proposal. and then you need to monitor. They are actually responsible to monitor the progress of your study because they have the right to terminate your study if you have created any disability or injury or even death. So next one, can I continue? Are you okay? Okay, right. So next one, because we have no class right next week, so we will be a bit packed for this lecture, but never mind, we will have off, 1 week off for the next week, okay, next week holiday. So next one, we will have a further improvement of the ethics standard, so which is known as the Bellman report. So these Bellman reports already start to focus, okay, initiate the focus of the three principles. Instead of the 4 principles, it is actually started with the 3 principles. The first one, as I mentioned, respect for autonomy. You have the right to make your own decisions, self-determinant, beneficence, do the right thing, do the good things, and justice. Fairly distribute all the benefits or burden. Okay. So and then the ethics is further improved into a better version where we known as the 4 principles, where the lasting non-malefficient, okay, is included into the principle. So why do we need to include this malefficient? So why don't we just do the 3, and why we need an extra principle to include the non? So although always we are encouraged to do all the good thing, right? But sometimes people can judge the good thing can create harm to the other people. So malefficiency, the definitions is to do no harm. Okay, so without this one, people will claim that I'm doing something beneficial to the society, but you are sacrifice someone. Okay, for example, so can you donate, use a severely sick patient and use his organ to save 5 people? Can you? No, right? So they are thinking, oh no, I save 5 people, so I sacrifice 1 person's organ, but he already in a very ill situation, right? So that's why we need the includes of the malefficiency. So malefficiency stated that even though you are doing some harm, okay, try to not doing any harm. So even you try to save the other person, or you want to take some part of the patient and donate to another patient, okay, but you may already create some harm, okay, except the voluntary of the patient. So the last one, we have some modern principle. So our subject is actually focused in all the 4 principles, but some of the evolutions of the ethics you may encounter later. Some of them does include the confidentiality. Okay, in additional to all the 4 main principles, some of the modern ethics, modern principle actually include the confidentiality. And actually in the 4 principles we do actually cover, we will see in detail, we do cover actually the confidentiality. But this one, they actually categorize the confidentiality in a separate group. So it is important for us to know the confidentiality because we cannot simply discover the information of the patient. Can you share any info freely to the other person? So please take note that this is wrong. Okay, even though you are a doctor, you are a professional healthcare person, or you are a researcher, scientist with Nobel Prize or anything, so you do not have the right to disclose all the information from the patient. So this one is the one I mentioned already earlier, the 4 principles from the Buchan and the Childress. So these are the 4 principles we will going to focus in this subject. So the first one, respect for autonomy, is the respect of patient's self-determination. So meaning that the patient has the right to make their choice or make their decision. Okay, and the beneficence is do all the good things, do beneficial things to promote the best interest to the persons or the society. So here I provide the whole definition. Okay, and then the non-malefficient is avoid unnecessary harm. okay, or do no harm. Okay, and the last one is the justice, is the equitable sharing of the benefit and the burden, the disease burden in the healthcare industry. So we will see each of the example in more detail. So for the respect for the autonomy, okay, so what is actually covered under the respect of autonomy? We know that patients has the right to do the decision, so we have to respect. Okay, whatever the decisions of subject or the research subject or the patient, you have to respect their decision. Okay, because you have to know that they have the right to hold their opinion, to hold their view, to make choice. They have their right to make choice and to take action. Okay, based on their value and belief. So the respect meaning here not showing that your attitude. So you need to show in action as well. Okay, to show your respect, treat them well. So not saying that if the patient say no, I don't want to participate in your research, so you are doing some action to treat them, not really good. Okay, okay, again. Okay, so you need to give them a better attitude or better action, even though they say no, I want to quit, I want to stop from this research study. Okay, so you cannot, you have to respect their decision. So, and generally there is no right for a doctor to decide or to perform any therapy or intervention or recruit any patient into their study. So you need their consent. So everything you involve the patient, so you need to do a proper or formal consent to make sure that they are doing, they are agree, they are volunteer. Okay, they are volunteer to participate in your research, or they are volunteer, they are okay to involve in the surgery or involved in the therapy. So next one is the responsibility of the healthcare professional. So to make sure that if their research involves human subject, you need to disclose information. You need to tell the truth, cannot hide anything. You cannot hide any information. You need to tell them the exact risk. Okay, so they want to, whether they are agree to participate in your study is their choice, but you cannot hide any information. You have to ease your responsibility to tell them the truth, what are the risks. So this may cause death, or this may cause paralysis, or this may cause stroke, okay, stroke attack. So it's the professional, okay, is the doctor, healthcare professional has the responsibility to inform and to make sure that your patients or your subject has the complete understanding. Okay, so this one is very important. You can talk for 1 hour, but the patient or subject get nothing. They just thought that they are understanding. Okay, so usually how do you ensure the understanding of the patients or subject? So we will prepare some questionnaire, okay, to ease their understanding, not just telling like that and just telling in a brief summary. So we will create a questionnaire. What is the risk, adverse effect that I'm facing, that I will be facing? So list down all the risk. What are all the adverse effect you may encounter? So you have to tell the truth, and then make sure that they are volunteer. Okay, voluntariness is very important. No forcing, and even the patients is unwilling to join, the patients has the right to continue their therapy. Okay, they have the right to continue to receive the equal proper treatments for their disease. Okay, even though they are disagree to join their research, and you have to give. Okay, so no forcing and no pushing. You have to give adequate, sufficient time for them to think. Okay, usually the consents will not able to obtain within a 1 day or 1 hour. So you need to bring them, let them bring the form, let them to sign, and let them. You need a witness. Okay, you need a witness to be there to make sure that the subject is actually volunteer, and they have sufficient time for make their decision. Some of them may need to discuss with their family, right? So because of all the risk over the benefit. So they need some discussion. So make sure that you allocate sufficient time for them to decide. So telling truth, provide sufficient information. As I mentioned, voluntariness, respect the right to refuse or withdraw. Okay, as I already mentioned. So if they don't want to participate, you cannot force them, and they have to receive the same therapy. Okay, the good attitude or good action during their treatment. Respect patient's privacy. Okay, so this one you can see. In the respect of autonomy, we already include some confidentiality. Okay, so we have to respect patient's privacy. Try to not asking all those sensitive or unnecessary information, just based on your own curiosity. Okay, so ask only those information that is required by the research study, and try to make sure that only a limited populations or the team, okay, you have a team right in your research, only a certain people can access all the private information. So you cannot, it is actually have a very strict type regulation. You cannot simply discover the information, just by passing the pen drive, USB. Okay, so you need to have a specific person to hold all the private informations and make sure that the information is destroyed after the end of your study. Usually we will destroy, or we will burn into a CD to keep for a few years, maybe 3 to 4 years, and we have to destroy all the information, okay, after a few years. And you need a consent. The reason we need a consent is because we want to give the student, the patient, with the right to choose. Okay, so versus the paternalism. As I mentioned, this one is a controversial. Paternalism is everything is decided by the doctor. Patients has no right to decide, and always they will think that this is the best treatment or therapy for you. But you only can provide the information. You can provide the sufficient knowledge to help or to guide the patient to decide, but you cannot decide for them. Okay, you can provide them with a sufficient background, sufficient info, and let them to make their own decision. Okay, so informed consent is sometimes certain types of the agreement. Okay, so you need to get the agreement and provide complete or appropriate information. So usually in this process, there is a very good timing for you to ask any question. What benefit do I get? Do I have any rewards if I join your activity or research? So is it legal for you to give any rewards? No, right? You cannot attract participants by giving some gift or attractive gift. Actually, it is not compliance to the rules. Okay, so the participants or subject have to enroll based on their voluntary. Okay, they have to ensure the subject is understand all the information by using the question A, and give participants sufficient time to consider, to decide their voluntary. So we have some populations with diminished autonomy. So we know that the autonomy is the right for a person to choose what they want. So what is the meaning of diminished autonomy? So diminished autonomy means that there are certain exclusions of the populations where they do not have the right, they do not have the ability. They have the right, but they have no insufficient ability to decide for themselves. So the first one is the early childhood. So when all the kids and the children, do they have sufficient knowledge to decide the right treatment for them? No. Okay, so this is one very good example, and usually parents will have the right to decide for them. And then we have the limited ability. So for those people, we have the limited ability to perform some activity. So it's also have some limited right for them to decide. Okay, because some of the activity have to depends on the physician using the physiotherapy, right? So they have a limited right. And those with the mental incapacity. So for those who have improper mental capacity, will not have a full right. Okay, will not have a full right to decide what are the choice they want or decide what they want, because they have a problem in the mental. So how they can interpret the desire or the reasoning or judge thinking all the benefits or all the risks. So it is inappropriate if you ask those with mental inappropriate populations to make their own decision, right? And then the last one, prisoner. So usually prisoner not saying that they don't have the right, but they have limited right because they have a limited exposure to the society, and usually they will consider classify under the vulnerable group, meaning that they have very weak health problem or fragile, okay, very weak condition, so they are actually have limited ability to make decisions for themselves. So one example, now we have one example. We know that everyone has the right, okay, to decide, to make the choice. This, okay. So we know that we have the right to choose right what treatment we want. So what if we have a situation like this? So this patient requested to amputate. Amputate is to remove, to cut off his or her limb. Okay, but no problem with her limb. But he requests, I want to remove because I feel uncomfortable. I feel discomfort with all my limbs, and because I feel something is wrong with my limb, so I want to remove. So actually this is one kind of disorder where we know as the emphantinophilia, which is a disorder that caused by a body integrity identity disorder. Okay, so they're just not satisfied and they want to remove their limb from their body. Okay, so if you just ignore them, they will injure themselves. They will cut their limb slowly. Okay, using some knife or some blade, so they will cut slowly and remove their limb. Okay, so there is a surgeon, Robert Smith, in Scotland. Actually, he already removed the limb for two patients suffering from this disease, and this disease actually is just a mental disease. Okay, even though the patients has encountered all the psychiatric and all the physiotherapy treatment, but they still want to remove their limbs. Just no any reason, they just feel discomfort and they don't feel comfortable with their limb. So this doctor has actually decided to remove the limb for the patient, and this has raised a strong argument in the bioethical issue. Okay. Okay. So if you were the doctor Robert, so now is the thinking time, analysis and thinking time. So what will you do if you are the doctor and your patient has requested you to amputate their limb from their body? This one is their right. I can request. I'm the one to choose the treatment. I have the right to choose the treatment, right? So why do you want to bother me? I want to remove all my limb. So you just do for me. Right? So what will you do if you are the doctor? Very hard, right? Very hard to choose, right? It's a very hard decision. Okay, anyway, this doctor has actually already performed some unethical, okay, activity, as according to the autonomy, so the patients has the right, okay, to choose the right treatment or to choose what they want, but actually this patient is having some mental problem. So can you just do the surgery to amputate their limb without any problem? The legs and the limbs are healthy. You have no right to remove the healthy limb from the patient. And the patient is importantly, the patient has already no ability to justify, to differentiate what is right and what is the wrong choice for her or him. Right, agree? So this is the example where for the mentally incapability people, there has no right for the autonomy. Okay, there has no right for choose the decision for themselves. And another reason, doctor or healthcare professional has no right to remove all the healthy tissue. Okay, the doctor only has the right to treat the disease part. So if you have this portion, you are sick, the disease, The doctor can treat the disease part, but doctor do not has the right to remove the healthy part. Okay, not the limb, the arm, the hands or elbow, anything. Okay, they have no right. You can only focus on the disease part which create the problem, but this one is the healthy leg. It's healthy. Okay, so you have no right to do that. So the next one we have non-malefficiency. So the definitions for non-malefficiency is always we do not do harm, not to do any harm, and then it is your responsibility to reduce, okay, all the unnecessary harm to your patients or your subject, and all the cruel thing, inhuman things, okay, are unethical. Please remember all the cruel or inhuman things. And sometimes patient do have some different tolerance, okay, based on the risk and harm. Some people will say, oh, if you damage my lung, it's already a very serious harm for me. But some patients will feel that the harm for him is actually something related to death. Okay, the tolerance of every individual is different. Even though your tolerance is different, harm is harm. Okay, try not to do anything with harm. Okay, try to do no harm. And if you try to harm someone to save another, okay, it's also wrong. Okay, as shown in the theory problem. If you want to donate the organ of an ill person to 5 healthy individuals, so they are wrong. Okay, so you need the consent. So another example is we have M. Okay, we have 2 M will need a bone marrow transplantation. So it's actually if he do not receive this surgery, so the M will die. So he will need a transplantation surgery, and his cousin or her cousin is already tested and is a suitable match to donate the bone marrow for M. Okay, so S. His cousin is S, so S is actually suitable to donate, but S actually already has agreed to donate his bone marrow, but in the middle, before the surgery, he changed his mind and withdraw, okay, from his consent. So M is very angry because he's already lost his hope, okay, because it's very hard for find someone with a match, okay, match bone marrow. So he applied to the court and forced S to donate the bone marrow. Okay, so if you are the jury, so what will you do? If you are the jury, so you will think that M should donate the bone marrow to his cousin, or you think that it's okay, no need to donate, just don't care about your cousin. So what do you do if you are jury? So the answer is, it's not wrong. Okay, so based on the autonomy, so it is not wrong for for S to withdraw, because S has the right to decide. And in another principle, the non-malefficient, so we should not harm one person. We should not force someone to harm his body and benefit another person. We cannot force. But if the S is doing upon his own voluntary, so it is okay. Okay. But if he already decided and worried about the risk of this surgery, so we has no right, okay, to force or to enforce the donations of the bone marrow. How many slides I still have? Oh my God, I still have a lot. So next one, we will go slightly faster. So for the beneficial, so is to do all the good things. Okay, to do all the good things, you have to maximize care for the patient, to promote all the good things and prolong life, restoring functions. Everything are under this category. Okay, beneficial, to do all things, act positively, and then please do not over exercise the beneficence. Okay, because if you over exercising beneficence, it will actually end up with the penalism. Okay, you can share the knowledge of how this benefit, but do not decide. Okay, do not always decide. And if you have a situations to have a reduced harm, is a reduced harm is actually considered under beneficial or non-malefficient. Reduced harm. Reduced harm is actually under beneficial because non-malefficient we are saying no harm. Okay, to do no harm. So this is the difference. And we have another example where we have a conjoined twin. Okay, so Mary and Jody is actually a conjoined twin where they share the abdominal. Okay, they share an abdominal and they're sharing the spine. But Jody able to actually support, okay, her own life. However, Mary is actually depends on the Jody. Okay, because Mary do not have a proper heart and proper lung. Okay, so it was like that because the Jody is actually able to live and is able to carry on his own life. If Jody was not separated from the Mary, so if they are not separated, so both of them will die because it is very hard for Jody to keep supply the nutrients, keep supply the blood to the Mary. Okay, so the conjoined are still young and not able to make decisions for themselves because, as I mentioned, the early childhood, they are not able to, they have restricted autonomy or diminished autonomy. They cannot decide. So the parents will decide for them, but the parents refuse to separate. Okay, even though the parents know that both of them will die, but the parents still refuse to separate. And this issue already because the parents believe that this is the decisions in hands of the God. Okay, the parents will leave the situations to the God. Okay, to determine the death. Okay, the death of the Jody. So what will you do if you were the jury? Okay, this issue is actually bring to the court because the doctor involved in this case is actually submit the case to the court saying that they want to separate the twin. Okay, because in the doctor viewpoint, why we want to let two twins to die if we can save one? And the doctor responsibility is to save life, right? So they are strongly encouraged to separate the twin because the twin will be able to survive by their own. But we will, at the end of the result, is Mary has to die. Okay, but the parents is strongly refuse to separate them. So what will you do if you are the judge? Very hard decision, right? So actually, it is not wrong that you just don't separate them. But in terms of the doctor view, it is a waste if you not save a human. And from the viewpoint of the judge, it is we are not killing Mary because he actually has a lack ability to survive herself. Right? He has no heart and no lung, so he not able to survive. So at the end of this result, so the judge actually has agreed. Okay, the operation. Okay, the judge is actually agreed to the operation, and they already separated. So the results, the outcome is the Mary is die and the Jody can survive. Okay, for a certain periods of the time. So in these situations, we know that there is always no exact answer for the right and wrong. Okay, so even though you bring to the judge, you feel that it is unethical, okay, to sacrifice Mary, but there are still someone is doing in that way. Okay, based on the judge results, they are not even wrong. Okay, they are acceptable because they want to save another life of a person. Something wrong with this. then the slide want to protest already. They want to continue. The screen not appearing.
你想睡觉？喂，我又找了东西。
我找了，看我找那么多都
可是我这个不行。挺多，可是它不 sell 去，我懂它。冰茶的话要去开刀。如果它不出来的话呢？那我喜欢安迪拉。我脸上以后就是变成这个样啊，变成那个。
他就找哦。
如果它 implant 的话，
对。什么会让它 implant？
我自己隐藏，我自己本身的地方，越来肿越大了，它是。
Just a few slides more for us to finish. Very quickly. Please be patient with me.
你要吃饭吗？我知道你9点上班。
So the last one we have the justice. Okay. So justice is the equal distribution. Doesn't matter is the benefit or the disease burden. So you make sure you treat every person. Okay. In a similar equal. Treat everyone equally and with the equal deserve, equal benefit and distribute the benefit, the burdens and the compensation. And the justice actually also covers some types of the fairly access to the resources, and then including some of the without discrimination, okay, without any bias. So everyone should receive some similar, some fair resources, okay, in terms of the healthcare facility, and do not exploit. So do not exclude some population which is actually weak or which you think like they are not suitable in your research study. So you need to recruit your participant or subject equally, okay, fairly and equally, and do not exclude eligible candidates who may benefit from the participant. So sometimes doctor will recruit the participants based on their own decision. They are not randomly recruited. So they will see that, oh, you need to do, you can benefit more, okay, in this study. So I will recruit you. So this is not the right way. So you have to do everything in an equal and a fair situation. Okay. So we already finished our lecture for the lesson 1 and 2. So supposedly I will release the assignment. Okay, as I mentioned, you all will have 2 assignments, right? One is the writing essay, another is the case study based on the book. Okay, because we have only 7 weeks. Okay, 7 weeks in this lecture, we have very limited time. Okay, it's a bit rushed, I know, but sorry, because last week we already have no class. Okay, week 1. So and then we have class in this week, but next week we're going to have holiday again. Okay, so actually this assignment should be released next week. Okay, but because of the holiday, and I don't want to disturb you all to enjoy your holiday, so I will release first, okay, the assignment, but you can do it after your holiday, okay? Or if you have any question, we still have another class, okay? We can discuss after the class, okay, in the coming time. But I want to let you all know that we have this assignment today, okay? So today is you need to submit an essay writing, and the title is Creating the First Raw Genetically Modified Baby. So actually we have a very well-known scientist, He Kian-Hui. So he already created, okay, without any ethical approval, okay, based on his own desire, he created the first genetically modified baby. So please go through the video. Okay, the video will go through what is the story of this baby and how it is performed and you need to provide an essay. So the content of the essay you need to include is the title, of course. Okay, so this one common sense. You need to include the title, and then the background. Tell me what is happening in this story. Okay, tell me what is happening, and then what is the violation? What is against the ethics? So you have already learned, right? We already go through the 4 principles. Okay, so what is against? What are the violations against of the ethics principle by applying your knowledge and your ethical knowledge and reasoning? Okay, and then what are the impact and what will happen as a result of this unethical action? Okay, so it should comprise 4 paragraphs. The title no need paragraph, 1 paragraph of background, 1 paragraph of violation, 1 paragraph of the impact. And then the last paragraph, if you have a second chance. So it's a free discussion, okay? So as I said, there is no a definite answer of wrong and right, okay? So we are discussing some bioethical dilemma of the problem from your viewpoint after you already have all the ethics. So if you have a second chance, how should the study be conducted properly? Okay, so you need also to include some citation and reference and provide a soft copy in the Word form or the PDF form. So all the assignment submissions is through online. Don't print for me all the hard copy and submit to me physically. So you need to upload your assignment into the e-learn system. Okay, online. I think by end of February. Okay, the last week of the February. I already included the due date in the subject outline. Please check, if not mistaken, it's 25th or 26th February. Okay, so please check. And the format, you need to have a proper workout. Because I'm dilemma with the student, give you a very long essay they have to go through. Okay, please include only the important point. Okay, don't turn and turn, round and round, and then without any important point. And standardize your format, the font size, and double spacing, a normal format. Okay, submit in soft copy. And you need to check when you submit your assignment in the e-learn. So there is an automatic checking for plagiarism. Okay, please submit your reference in a separate sheet because usually the reference will create a very high percentage of the plagiarism, meaning overlap, because most of you may use the same reference, right? So the reference usually will create a very high percentage of plagiarism. So the plagiarism, try not to more than 25%. Okay, reduce the plagiarism. And I already listed some marking rubrics, and this assignment I already uploaded in the e-learn. Okay, you can go through first. Okay, no hurry. I want to share with you about this assignment earlier. Okay, so that you have sufficient to think or to think about when you are celebrating Chinese New Year. Okay, so you have some brainstorming. Okay, during your holiday time. Okay, so I think that's all. Let me see. Okay, I still have 1 or 2. Okay, very quickly. So what are the background you need to include? So you have to include some background for the well-known scientist. Okay, He Jiankui, and then how is his recruitment of participants, background and setting, and what are the brief explanations about this experiment, how he is going to conduct, and what is the outcome of the experiment. And most importantly, and the last but not least, what happened to this scientist at the end after he created the baby? Okay, so is he still alive? Because he's doing in Stanford, okay, or China Shenzhen University. Okay, so what is the outcome? What happened to the scientist? Okay, you have to include. And last thing, this one is another paragraph, is the violation. So try to discuss what are all the unethical issues based on the 4 principles. Okay, we already learned respect for autonomy, beneficial, non-malefficient, and the justice. Okay, so after the holiday, so we will continue our lecture. Okay, on 19th, I think, not mistaken, 19th. continue. What are the responsible of the various stakeholder and the foundations of the ethical relationship? Okay, thank you.
二十四号。